Hello everyone. Today, we are going to be discussing a question from Typical PT's platform. Let's jump right in. Alright, here's the question. A 51-year-old male presents to physical therapy following referral from his PCP for evaluation of recurring episodes of severe dizziness for the past 3 years. He describes the sensation as the room spinning violently, with episodes lasting 2 to 4 hours. These attacks occur unpredictably, approximately once every 1 to 2 months. He reports fluctuating hearing in his right ear, occasional right-sided tinnitus described as a roaring sound, and periodic feelings of fullness or pressure in the affected ear. Symptoms have progressively worsened, causing him to miss work and avoid driving. His PCP prescribed meclizine, which has provided minimal to moderate relief during episodes. Objective findings: cranial nerve screen, intact facial movement and sensation. Balance testing: positive Fukuda stepping test with rotation toward right side. Negative Dix-Hallpike maneuver. Modified clinical test of sensory interaction in balance, MCT-SIB. Increased sway with all 4 conditions. Gait: normal between episodes. Reports needing to sit or lie down during acute attacks. Vestibular screening: no positional triggers identified during examination. Occupation: accountant. Reports increased stress during tax season. Living situation: 2-story home with spouse, no children. Given the patient's pathology, which of the following tests should be performed? A. Saccades. B. Horizontal head impulse test, HHIT. C. Cover/uncover test. D. Vestibulo-ocular reflex cancellation, VORC. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice B, Horizontal Head Impulse Test, HHIT. Before we break down the explanation, I want to mention that the infographic shown here is from the Physical Therapy Essentials book from Typical PT. You can find this diagram and other helpful resources inside that book. Answer choice B is correct because the stem describes Meniere's disease. This condition is characterized by the classic triad of episodic vertigo lasting hours, fluctuating sensory neural hearing loss, tinnitus. All of these symptoms are present in the case. The patient also reports oral fullness in the affected ear, which is another common symptom seen in this condition. Meniere's disease is classified as a peripheral nervous system vestibular pathology. Because of that, the most appropriate test listed in the choices is the Horizontal Head Impulse Test, or HHIT, which evaluates peripheral vestibular function. Now let's walk through the diagram shown on the screen. The diagram compares central versus peripheral vestibular disorders. Central disorders involve structures such as the cerebellum, brainstem, and vestibular nuclei, while peripheral disorders involve the semicircular canals and the vestibulo-cochlear nerve. Meniere's disease is shown under peripheral disorders, which aligns with this patient's presentation. Now let's review why the other choices are incorrect. Answer choices A, C, and D are incorrect because they evaluate central nervous system vestibular pathologies. Choice A. Saccades assesses ocular motor control and is used to screen for central vestibular or neurological dysfunction. Choice C. Cover/uncover test evaluates ocular alignment and can identify central ocular motor abnormalities. Choice D. Vestibulo-ocular reflex cancellation, VORC, evaluates the ability to suppress the vestibulo-ocular reflex, which also requires central processing. Since the patient's presentation is consistent with a peripheral vestibular disorder, these central vestibular tests are not the most appropriate choice. Now that you've completed this case, take a moment to record the key points in your Typical PT digital notebook. Use it to organize what you've learned and reinforce how to apply core integumentary concepts when evaluating and managing neuromuscular-related conditions. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.